There's a new push to provide acute care to patients in their own homes. A report has found that treating patients with infections at home rather than in hospital cuts costs by more than 30%. Patients are happier, and hospital care in the home also frees up beds and reduces waiting lists.
Life is as normal as it can be for Ian and Sue Mackay, despite the 59-year-old business analyst needing daily acute care.
I can't see why I should be taking a bed up in a hospital when I can be at home in my own bed.
Diagnosed with an infection in his spine, Ian Mackay spent 10 days in hospital. He was then given the option of staying there for 6 weeks to have a course of antibiotics or being treated at home.
We're getting all those services that we would have gotten in the hospital anyway. We're getting them at home.
And getting them for a third of the cost, according to a new report.
We know it's not only safe, but the patients are happier being treated at home, and now we know it's cheaper too, so it's really a win-win-win.
The research compared the costs of providing hospital and home care for patients with 6 conditions, mostly infections. In all cases, the public hospital care costs were higher.
The potential savings are substantial, and certainly it's an area which deserves further attention.
But the take-up of the program has been limited, except in Victoria, and that's partly blamed on poor Medicare rebates for doctors. The federal government is now being urged to make changes to the Medicare benefit schedule to increase the involvement of GPs and specialists in the service, taking the pressure off hospitals. But the government says it's a state responsibility. Ian Mackay is preparing to go back to work, and he's glad it's not straight out of hospital.
Definitely. I would have been a different frame of mind. I'm itching to go back to work now.
That could be in less than 2 weeks. Rebecca Barrett, ABC News.